I know you're muting me, but can you hear me? Make sure my audio is working.
Oh, yes, I can hear you. And yes, you sound good. Sorry, I muted you. I thought we were up on TVW, which we are not yet, but I do believe we may be on Zoom. So thank you. Oh, I can see you. Scott, you look great. Dr. Shah, you look good. You look great too. Michelle looks gorgeous. And who else do I see? Brian, fabulous. Just waiting on video from Lacy. All right, it is 8:16. I am going to let TVW know we are ready to roll. So stand by. We will begin in about a minute and a half. Good morning, everyone, and welcome to the Wednesday, June 9th COVID-19 response media briefing. I am Julie Grauert, your facilitator for this event. I'd like to welcome our panel today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health. Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health. Dr. Scott Lindquist, Acting State Health Officer. Lacy Fehrenbach, Deputy Secretary for the COVID-19 response. And from the Washington State Department of Labor and Industries, Brian Haight, Compliance Manager for the Division of Occupational Safety and Health. To begin today's briefing, we will open with remarks from Secretary Umair Shah. Dr. Shah?
Thank you. Julie, hold on one second. I'm trying to just make a quick adjustment on my Bluetooth. Give me one moment. Can you hear me okay?
Yes, we can, and we can see you as well.
Okay, perfect. All right, well, good morning, everybody. I just want to start by saying thank you to all of our media partners again for joining us, as you have done for the last, at least since I've been Secretary of Health for the last 6 months, and certainly continuing the media efforts that we have engaged in since last year under Secretary Weisman. So I just want to say thank you to all of our media partners for, again, being with us today. There are a few things we're going to be talking about today. And as you heard, we have a colleague from Labor and Industry. And so we're really happy to be able to have him join us. And Brian's going to be really describing some of the workplace requirements and stipulations that are in place. So I think that'll be a really helpful conversation. We thought it would be really good for you to hear from L&I directly on one of these media briefings, because there were some questions that came up over the last couple of weeks. In addition, I want to talk about our vaccine progress to date. As you all know, we're about to hit our 6-month mark. And then I do want to talk a little bit about the numbers that we've been seeing in terms of improvements and protections for those who are vaccinated. And then we will touch on the fact that we've still got a ways to go. So the message being that we want to make sure people are availing themselves of vaccines regardless of where they go in the state of Washington. And then we'll touch on the lottery. There have been a few questions that have come up over the last couple of days. We'll touch on the lottery. We'll talk a little bit about the epi curve, and then we'll have something exciting to talk about related to WA Notify with Lacy Fehrenbach, and we'll turn it to her and as well. before we get to Michelle, who's going to talk about more specific vaccine updates. So with that, let me start by, if we can just show that first graphic that we have been showing essentially on a weekly basis. And if you all remember, this is really looking ahead way back in, it's January, February of when we were really looking at what was going on and what we needed to do in the state of Washington. It was really about supply, logistics, and demand. And supply at that time was the short leg of the stool. Fortunately, supply is not the issue anymore. We have plenty of vaccine in the state of Washington. Logistics at one point was a challenge, and we worked through with our providers. And again, thank you to our local health jurisdictions on the ground and everybody working hard in the private sector, healthcare sector, to come together so that we had logistics working in the right direction and now no longer an issue. And then it was really about demand. And the demand, I think if you all remember, I had made it very clear very early on that the demand oftentimes will be one of those challenging pieces that is going to be what we are going to need to address throughout this pandemic. And that's exactly what has happened. And we continue to work with our partners. And really, as that demand has softened and in many places has decreased, we want to make sure we can do whatever we can to make vaccines both the easy choice, but also to make sure we do whatever we can to help people and encourage people to get vaccinated. And that's why the efforts from this past week with the lottery and the incentives that the governor announced last week are really exciting, because it really helps us move people, we hope, to get vaccinated if they're still not certain about that. So next Tuesday marks the 6 months of vaccine rollout. And obviously we'll talk about this on Wednesday of next week as well. But I really am proud of the progress that we've made when it comes to supply, logistics, and demand. And I want to thank our partners again for making this possible. Let me show a few of our statistics on where we are with vaccines thus far. As you can see, we have now given more than 7.2 million doses of vaccine in the state of Washington. And Michelle will be the first to tell you that that is just unprecedented when you compare that to vaccinations in a normal year or a normal season or childhood vaccinations. Whatever metric she wants to slice and dice this with, this is really an incredible effort. And we just have to keep that in mind as well. To have a new vaccine, 3 vaccines that are all safe and effective, and then to roll those out and in 6 months be able to deliver 7.2 million doses is just amazing. More than 3.9 million people have received at least 1 dose of COVID vaccine. That's nearly 64% of the population 16 plus. And let me pause here for a moment, because this past week there were also some questions that a few of our media partners asked because the White House and the federal government had released that state of Washington had hit the 70% mark. But as you know, that we did clarify that over this week, and please refer to that press release, that when you look at the 70%, that was really the main difference between the 70% metric and the 64% metric was the population denominator of 16 plus for the 64%, and the 70% that the federal government is using is the 18 plus population. And then there are other considerations that we talked about related to DoD and other channels that were also not fully or not able to be counted in what we were doing. So just wanted to make sure that everybody was recognizing that we did acknowledge that there were some differences in the federal government 70% and our 64%. Remember, the 64% is what is being used for the state reopening metrics, and otherwise it would be June 30th, if not sooner, if we can get to 70%. Regardless, both of these are different ways of looking at the numbers and the data, and both of them show incredible progress. And we were, per the federal government, the 13th state to hit the 70%, again, ages 18 and above. And again, this is just the progress that we've made in the state of Washington. And I just want to continue to recognize that this is all positive and good news. We've also had more than 3.4 million people who are fully vaccinated above the ages of 16 and above. And that's over half of our population. So we're making tremendous progress to the full piece of getting people vaccinated fully and protected fully. And obviously we want to continue to make progress here. So everything that I'm describing is really about two ways of looking at this. One is tremendous progress in 6 months, but also we want to continue to keep that momentum going. So let me show a couple more here on the next slide. More than 116,000 kids ages 12 to 15 have received at least one dose. And again, if you can think about how Washington has really been one of the leaders in states across the country. And I really do want to just recognize the incredible efforts that our teams across Washington, including at Department of Health, but well beyond, and even our pediatricians and family medicine physicians and healthcare providers and nurses, everybody who has been working together to encourage parents to get their children vaccinated. So I just wanted to acknowledge that as well. And then since March of 2021, this is an interesting tally that I would put out there, that we have answered with our Vax Help and our different ways for people to be able to check in with us or have a question for us. We've answered more than 80,000 calls and helped schedule more than 32,000 vaccination appointments. So if you think about that, 80,000 calls is not something to to minimize. This is really an incredible effort, and I want to thank not just our DOH team and our partners throughout the state that worked with the state agency partners, but I also want to thank our VAC Center and our private sector partners who really helped with the call center and really making sure that we were automating and doing whatever we could so that we could handle such a volume. And I think people will agree that that has been a very strong effort. And so just want to recognize the work that's been going on there. We know vaccination is working to protect people, and we know that it's reducing the impact on the healthcare system, and we know that it's getting us back to normal as we have talked about. And remember, as we were talking about flattening the curve and doing all sorts of things to make sure our healthcare system did not have an overrun or was not overburdened, we are absolutely seeing that progress. And I want to really recognize that progress over the last 6 months. As of May 15th, and this is, our data lag just a tad on this. The 2-week hospitalization admission rates for unvaccinated people, 45 to 64, were 21 times higher than for vaccinated people, as you can see on the left side of this curve. And then on the right side, you see for ages 65 and above, the rates were 18 times higher in unvaccinated people than in fully vaccinated people. And that is really, again, just recognizing that vaccines truly represent protection. Not only do they represent protection, I've said it many times, I want to make sure we do not see in the state of Washington, or frankly anywhere in the country or the globe, a tale of two societies: those who are vaccinated and protected and going about their business and being able to not be as concerned about COVID-19 transmission or infection, and those who are unvaccinated and unprotected, who are still going about thinking falsely that they are protected, or somehow the pandemic is over and the virus will not be an issue, and then get in trouble because they get sick. And we're showing that we are still seeing people getting sick and getting hospitalized. So this is not something that we want people to not pay attention to. And also we want to make sure we're doing everything we can to get people vaccinated. So today is the time, now is the time to get people vaccinated. Around 36% of our state population, 16 and above, has not started vaccination, right? So the flip side of 64% is that we still have 36% that has not started vaccination. And we want to make sure we continue to emphasize that now it's easier than ever to get vaccinated. There really are no lines, there are no issues in terms of transportation that people cannot avail themselves. We want to make sure that people who have gotten vaccinated are helping protect themselves and their loved ones, and they are helping those loved ones get their appointments today, and so we can enjoy the full benefits of reopening. An example of the ability to get vaccinations and vaccines today is the Lumen Field site. And I want to really recognize the efforts of King County and City of Seattle and all the partners in the healthcare system. And I had a chance to visit Lumen Field on a couple of occasions and just was amazed by the work that they had done. As you remember, this is one of the biggest sites in the country, and it's closing next week after 3 months of operation. They have vaccinated tens of thousands of people, and it is closing on Saturday. And so one of the messages we want to give to people is, look, before Lumen Field closes, this is the time for you to be able to get vaccinated, to go into a Lumen Field or go into a pop-up clinic or go into something that's happening in the community in a pharmacy or in a local health department or a tribal vaccine partner activity, and you can get vaccines today without waiting. And I want to make sure that we do everything we can to recognize that piece of what's happening. So let me shift to the lottery now. We are working with, as you know, the governor's office, the Washington Lottery on the first weekly drawing for Shot of a Lifetime. It's more to come later today. As you know, the governor is going to be having a press conference later today. So I certainly don't want to get ahead of any announcements that he is going to be making. But I do want to say that we do know that over the last several days, we did have some folks across Washington who had a few issues accessing their vaccine data over this last week. Obviously, we recognize that people were very enthusiastic and very excited about the lottery, the Shot of a Lifetime initiative. As over this last week, we have been working quite intensively to resolve any of the issues and improve access to records. And I know Lacy and Michelle would be able to talk about this in more detail, but really the message that we want to really help, if you could help us, our media partners, continue to get out there, is really our 833 VAX help number. This is really that number, not just for people to figure out where to get vaccinated in the state of Washington, but also for those who need help with their vaccine records. What we have done behind the scenes, we've increased the staffing, we've made some adjustments to our processes, and we have really made an incredible amount of efforts to really assure that we are working with all of our partners behind the scenes so that we can field the calls that we have been getting. The bottom line is that more than 3 million people have been eligible for these drawings, and we are so excited to see even more people get vaccinated. And I also want to say the bottom line is that this has been a tremendously positive, enthusiastically received initiative by the state of Washington, our Washingtonians. That said, that also means that people will contact you to make sure that the data, that they know what's happening with their own vaccine or immunization data. And that's the overwhelming numbers that we were seeing. I use the word overwhelming. It's not overwhelming in terms of the outreach that we had gotten or the number of calls that we had received, but we did see an uptick in activity. We did see interest in both through the Vax Help and other modalities, people contacting us, and we have now made adjustments so that we can continue to field those calls. So again, we want to remind Washingtonians, if you've already been vaccinated or if you were not vaccinated yet, that we want to make sure you do everything you can to get vaccinated, help someone else get vaccinated. And by the way, you can also win something in the midst of doing what's right for you, and also to help you get protected, you can also win a lottery, which is not a bad thing. I want to, if we could just look at some of the disease trends. I know Dr. Lindquist is on. Certainly if Scott has anything he wants to add to this during the Q&A, we can certainly do that. Reopening on June 30th is approaching fast. We're just about 3 weeks away from this. We're continuing to see positive trends in disease activity. And this is something that I think all of us are watching, and we certainly want to continue to just do whatever we can to beat this virus into the ground. We've had almost 442,000 confirmed and probable cases to date of COVID-19 in the state of Washington, almost 5,800 deaths that we have also seen in the state of Washington. I will want to just recognize that we removed about 70 deaths yesterday after we did a process update and a more intensive review that determined these individuals their deaths were not related to COVID-19. So I do want to acknowledge that, and certainly Scott and Lacy can talk about that if the question comes up. I also want to just make sure that you're seeing that the epi cases are declining. Again, we continue to watch this very closely. The statewide cases and hospital admissions are declining. We are off that fourth surge. It's going in a positive direction. We want to continue to move in that direction as well. I want to close with just a couple of other comments, and then I will turn it over to my colleagues. The mask reminder, we still want to remember what we've been saying for the last several weeks of respect the rules of the room that you're in or the jurisdiction that you're in. We want people to just recognize that if an establishment or someone nearby you or a local health officer is asking you to wear a mask, that we would ask you to respect the rules of the room and wear the mask and be respectful as that person is trying to do what they can to protect themselves or their families around you as well. We want to remind everybody that the mask order is still in place now, and it certainly is in place for those who are unvaccinated. Vaccinated people in most settings are not required to wear masks, but absolutely we know that there are going to be people who are still going to choose to wear masks, and we want to make sure we encourage that as well. And certainly the mask orders will be in place after June 30th as well. And really we want to do everything we can to encourage our communities to get vaccinated. I think that's the bottom line message here. And so we'll have Brian Haight from Labor and Industries on the COVID-19 workplace safety and how to use masks and what those requirements are in our establishments. And so Brian's going to join us for that. So let me just close by saying together we're continuing to protect our communities. We do not want to see a tale of two societies in the state of Washington. We're saving lives. We want to save more lives. We want to get people vaccinated. If you get vaccinated, you protect yourself, you protect your loved ones, you protect those around you, you protect your communities, and ultimately you can also win some prizes. And so that's what we want to do, is to make sure that everybody is recognizing those incentives. You know that there was also another incentive this week, from a cannabis standpoint, and I know that's gotten a lot of national attention as well. Look, whatever it takes to get people vaccinated, we're encouraging that, and we also want to make sure that people are behaving responsibly as they partake in any of the activities that are out there, whether it's because of an incentive or if it's because of making sure that they can help us beat this pandemic. So with that, I want to say thank you to all of you, and I am going to first turn it over to Lacy. She's going to talk about WA Notify, and then we will turn it over to Michelle Roberts, who's going to give us some more vaccine updates, and then we'll go to Brian. Brian, thanks for joining us today. So with that, Lacy, we'll turn it to you for WA Notify.
Thank you, Dr. Shah. Good morning. Another success to share. A study from the University of Washington estimates that WA Notify helped us prevent about 6,000 cases in Washington state and saved 30 to 120 lives in the first 4 months of use. Researchers at the University of Washington and our Department of Health used modeling studies of this tool and released their results in a preprint version on June 4th. Last week. Their analysis offers the first estimate of the public health value of Bluetooth exposure notifications in the US. A reminder to everybody, WA Notify doesn't need to know who you are or where you go in order to work, and the more people who use it, the better it works. This tool is available in 30 languages in Washington state. The tool sends alerts to users via Bluetooth if they may have been exposed to COVID-19 and lets them know that they can take action through testing to prevent further spread of the virus. More than 2 million people in Washington have enabled exposure notification since it launched on November 30th. That is nearly 1/3 of all smartphone users in our state. I want to thank all of our WA Notify users here in Washington and the great team at DOH and UW who support it. We're thrilled to see how many Washingtonians are still using this tool. We encourage you to still use it, and we're thrilled at how well it has worked so far. We want to give extra kudos and gratitude to our partners at the University of Washington for their work on this study so that we can share these exciting results. Together, we're using all of the tools we have. You heard a lot about vaccines, and we'll hear more about it today, but continue our efforts on contact tracing and testing, use of WA Notify so that we can protect our communities, save more lives, and move out of the pandemic. Back to you.
Thank you, Deputy Secretary Fehrenbach. Next, we will go to Assistant Secretary Michelle Roberts. Michelle?
Well, good morning, everybody. Thank you, Lacy and Dr. Shah. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. Before I talk about Shot of the Lifetime and some of our other work going on, I really do want to stop and pause to remember that it is 6 months into this vaccination campaign and the incredible work we've done. I think Dr. Shah offered me a challenge about how many ways could I slice and dice the data. So I do want to offer one other comparison for you guys, just about how incredible it is and how many people are protected and how much more open our communities are because of vaccination. So Julie, I don't know if you could pull up the slide of all age population vaccination. But the way I want to share the data today is that we are 6 months into this vaccination campaign and have given out 7 million doses so far. What I want to compare to is that over flu season, flu vaccination season every year, which is about 10 months of vaccination, we only reach, for comparison, 53 point, or actually if it's the whole population, 56% of Washingtonians are usually vaccinated, our most recent flu season numbers, over 10 months of vaccination. So now here we are sitting after 6 months of vaccination, and for our entire population, seeing a number much higher than that, and 56% of fully vaccinated 16 and older. So that's really incredible. And it just shows that the work we've done is a once in a lifetime, hopefully experience for all of us to really work to vaccinate our entire state as quickly as we can, definitely within our goals. We're within 6 to 7 months. So we are well on our way there. And it's bringing a lot of hope and a lot of opportunities to see our family and friends again safely. So as Dr. Shah mentioned, this week, our state kicked off its Shot of a Lifetime giveaway series. Everyone who's received at least 1 dose of the COVID-19 vaccine that's reported in the state's immunization information system has a chance of scoring cash and other prizes. The good news is that more than 3.9 million people were entered into the first drawing. We know many people want to verify that they're in the system, and unfortunately, some have faced obstacles when they've tried to get their vaccination records through MyIR. If you can't access your record that way because you're not matching on your first try, our COVID-19 hotline is here to help. Call 833-VAX-HELP. The hotline has trained specialists who can help callers check that their data is in the immunization information system and access their MyIR account and get them the information they need. Again, the number is 833-VAX-HELP. I also want to reassure people that their personal information is protected. We do not share it with a lottery unless the winner allows us to. The way it works, we assign each vaccinated person a random number. The lottery then uses a random number generator to select the winners, and the lottery gives those numbers back to us. We'll match the numbers to a name and reach out to the winner and offer them the prize. There are still 4 weeks left with lots of prizes, including the grand prize of a $1 million drawing. So go get vaccinated today. If cash isn't a big enough motivator, health should be. A new CDC study shows that the Pfizer and Moderna vaccines reduce the risk of COVID-19 infection by 91%. This study adds to the growing body of real-world evidence that prove these vaccines are safe and very effective. Now I want to talk about our data a little bit and the differences we're seeing between our data dashboard and the federal government's vaccine tracker. The state's dashboard represents the most accurate information we have control over, and there are a few reasons for the differences. The federal government gets data from federal sources that don't get shared with the Department of Health, such as data from the Department of Defense and Veterans Affairs. Washington residents vaccinated outside of the state may also not be in our system. DOH also uses more current population estimates than the federal government is as well. We're using 2020 population estimates, which are higher than the 2019 census data the federal government uses. And in order to reach our goal, 70% of people age 16 and older need at least one shot. And the federal government, for the metric they released this week, as excited as we are to reach their 70% metric, they're counting people 18 and up. We are committed to making sure vaccination rates are accurate, and we are working closely with our federal partners on this issue. If anyone has questions about COVID-19 vaccine, please visit our department's frequently asked questions page or talk to your healthcare provider. To make a vaccine appointment today, visit our vaccine locator website, text your zip code to GetVax, which is 438-829, to receive addresses of nearby vaccination sites, or call our COVID-19 vaccine number, 833-VAX-HELP. Thank you.
Thank you, Assistant Secretary Roberts. Our final panelist will be Brian Haight from Labor and Industries. Brian?
Well, good morning. Just want to start by saying that Division of Occupational Safety and Health, workplace safety and health is our number one concern. And COVID-19 has been recognized as a workplace hazard. And that's really why DOSH has taken on a significant role in this issue. Most of what we're doing is helping to develop protocols and strategies for workplaces and employers to protect their environments from this hazard, so that everyone can make it home at the end of the day in the same shape as they came into work that day. And I want to say that we really appreciate all of the hard work that employers and workers have put in to keep people safe on the job. And we understand that there's a small number of employers who tend to get most of the attention when they're not following the policies, but the great majority have really stepped up and really have worked hard to develop and follow policies and made a real difference. We're seeing the results of that every day as this continues. Even though we're making great progress in the state, there are still requirements in place for employers to make sure that workers are as safe as possible on the job. As of right now, employers, they have the option to allow workers to take off their masks if they can verify that they are fully vaccinated. We understand that fully vaccinated means 2 weeks after their second dose or 2 weeks after their initial dose of the Johnson & Johnson vaccine. The employers have to verify this status before they loosen the masking requirements, because they still have an overriding responsibility to make sure that they have a safe workplace for everyone. They have a flexibility to develop their process for verification, and they can choose whatever method will work best for them. What they need to see from their employees is one of several things. The employee can show them their vaccination card. They can show them a picture of their vaccination card. They can sign a written attestation document that says that, yes, I have been fully vaccinated. The employer has their choice how they want to develop a record to track this, and so that they know who has and who has not. With this, those who are fully vaccinated and it's been verified, they don't need to mask up in the workplace. They still have the option that they can mask up if they choose to. For the people who choose not to verify, even if they are vaccinated, or those who aren't vaccinated fully yet, they need to continue to wear masks in the workplace unless they are working alone. One thing that employers should keep in mind as they come up with their verification system is that there are other laws that govern things, like the American with Disabilities Act, that they should consider and follow as well in developing their process. And I also want to make sure that it's pointed out that the employees, even if they are fully vaccinated, if they want to continue wearing a mask in the workplace, they are free to do so. We think this masking policy will give businesses and their vaccinated workers more choices, more flexibility around masks and social distancing requirements, while still allowing everyone to be protected. I think that is
Great.
all I have.
Thank you so much, Brian. We appreciate all of that insight. This brings us to the Q&A segment of today's briefing. Our first question comes from Eilish from KUOW. Go ahead.
Hi, thanks for taking my question. Are people who aren't in the state's database, for example, veterans who got their shots at the VA, able to add themselves to this system so that they can become eligible for the lottery?
So let me just say that, first of all, we're working with our federal and state partners on a number of different initiatives, just to make sure that we are as accurate and responsive to whatever we can do to assure what's happening within our data systems, but also with folks who have been vaccinated. Lacy, Michelle, I don't know which of the two of you would like to answer that question. I know you both have been closer to this.
Yeah, I can go ahead and answer that question. Individuals are not able to add their records to the immunization information system. It is a system of medical records, and a healthcare provider needs to do that. We are working with the federal government to determine if there's other options, and exploring with the governor's office and lottery about, is there other options to ensure that our DOD and VA members who were vaccinated there could be included. So more to come. We're still exploring that. Anybody does have, if you have another healthcare provider, so maybe you were vaccinated at the DOD or VA, but you have a regular healthcare provider in the state who's not member of the DOD or VA, you could ask them if they'd be willing, if you show them your record, to add you to the immunization information system.
Thank you. Our next question comes from Steve from Como. Steve?
Hi, thanks very much. I think my first question is probably for Lacy. Last week, she had talked about the quest to get to that 70% number in terms of vaccinations. And I think, if I remember correctly, she had mentioned something about maybe hitting that point right around June 30th, or even a few days after. And I'm still wondering if that's still the belief this week. And wondering if any of you can sort of talk about what the impact will be on the state if we don't hit that number by June 30th. And has DOH had any discussions with the governor's office about maybe we shouldn't fully reopen the state's economy if we don't hit that number by the end of this month? And anything that's giving you pause right now regarding the June 30th date, based on the numbers you're seeing?
Yeah, Steve, let me just answer the second part, and then Lacy, if you can go to his first question. The second part is that we continue to watch the metrics and the numbers, and you know, regardless of how much improvements that we're seeing, and we are seeing improvements, as I've mentioned, and we've shown with our graphs, and you can see on our dashboard, we continue to watch it closely. Right now, we're not seeing any trends that make us feel uncomfortable with June 30th as being the outside date for reopening, and we're hopeful that we can actually get to an earlier date based on your question, and Lacy's going to respond to. But so far, we have not seen anything in the trends or anything from a concern standpoint that would make us make a recommendation to the governor's office to extend beyond June 30th. And in fact, as you know, there are also other factors nationally. You also have the president and the federal government who are also making announcements and changes in policy, and also giving guidance to states across the system as well. So there are a number of things that are happening on the federal level and the national level. And then obviously within our own state, we're watching the trends, and nothing thus far is showing us that we would need to go beyond June 30th. Now, if something changed or happened, obviously that would be a different scenario for us to look at. But right now we have not made that recommendation. Lacy, do you want to answer the other question?
Yeah, thanks, Steve. In terms of projections, those haven't changed a lot yet. We did see a pretty significant slowdown of vaccination among people 16 and older towards the end of May and early June. And it's a little too early to tell if the lottery has boosted interest in getting vaccination. But I think, you know, next week at this time, we might have more to share in that regard. I do want to reiterate, there is absolutely capacity in terms of supply and places to be vaccinated. As some of my fellow panelists said, there has never been an easier time to get vaccinated and protected against COVID-19 than right now. And there are certainly enough 16-year-olds and older eligible still to step forward and help us meet that goal by June 30th or even sooner.
Thank you. Our next question comes from Jessamine at Q13. Go ahead.
Thank you all for the time this morning. For Brian, I'm wondering if the same rules that are in place right now will extend beyond June 30th, and if not, what will they look like? Well, I guess June 30th or the full reopening whenever it happens. And for the rest of the panel, I'm wondering, you put in such amazing infrastructure throughout the state when it came to dealing with COVID-19. It's a little early to project beyond that, but I'm wondering what you're looking at, how this could benefit the healthcare system as a whole. As you have put all these things in place, where else could they be used? We've seen advances in mRNA research and other diseases. What about the infrastructure that you've put in place?
So for the first part of your question, Jessamine, thank you. At this point anyway, the masking requirements or the ability to not mask is going to stay in place for the foreseeable future. There's no plans to change that with full reopening yet. We'll still be working through getting increased vaccination numbers even beyond that, and we'll still have a need to protect people who aren't. So that will stay the same for the foreseeable future.
And I guess thanks, Julie. Thanks, Brian, for that response. What I would say from an overall standpoint from the state, and Scott may want to talk a little bit about the genome sequencing and from a disease surveillance standpoint. So I'll defer that to Dr. Lindquist. But what I would say outside of that, we are absolutely now looking ahead to what can this mean for our state. We do not want this to be a moment where we have built infrastructure and we've learned a lot, we've built partnerships, and then COVID instead of that being a moment where we can transform health, it actually becomes a moment that's lost. And so we do want to do whatever we can to transform health and see this as a way to build upon what we have learned and the relationships that we have created. But that requires a lot of planning and a lot of behind the scenes work, which our team, and as I mentioned a couple of weeks ago, we've made some changes even at our executive team level, at our leadership level within the Department of Health. We now have a new area for innovation. We also are made some changes in our policy area and really looking at planning as it moves ahead. Lacy has done just an incredible job when it comes to leading our COVID-19 response along with the rest of the team. And we're also looking at what does that mean for a future state of COVID response. We are nowhere out of this pandemic yet. I want to make sure to Jessamine, just to emphasize that point. We still have a long way to go, and this is not that we want to count our chickens before they're hatched. I mean, we do not want to look so far ahead that we're losing focus on the moment upon us, which is vaccines, vaccinations, and protecting people. That said, we also want to really be thinking about what is it that we want to leave for the future, so we can have a stronger public health system, a stronger healthcare system, and really a stronger health set of ecosystems, if you will, as we move ahead for transformational health. So there's going to be more to come on this, but I think you really teed up a question that we're really looking at for the future, but we're still focused absolutely on today. Scott, did you have anything you wanted to add from an genome sequencing standpoint?
Yeah, and Jessamine, just a reminder, never once in my wildest dreams did I think you and I would ever talk about R0. So this whole pandemic has really shown a spotlight on public health and really shown the importance. We've had a lot of discussion with the public about epidemiology and pandemics and R0s and all these things. And so that's probably the biggest issue that's come from this, is really showing the importance of public health, the need for public health, the tools we use in public health, and the need for ongoing funding. So with that, there's some very concrete things that I'd give you feedback on. And one of those is the ability to do genotyping or DNA fingerprinting. And that is a technology that we brought on in the public health lab that we are now talking about applying to things like tuberculosis and hepatitis outbreaks. Remember, we have one of the largest outbreaks in the state right now in hepatitis C. And hepatitis C can use these tools of genotyping. We've also set up in the public health lab a courier system for the entire state for getting samples into the lab. So I think this momentum carries forward to improve not only public health, but the healthcare delivery system.
Lacy, do you want to jump in?
Yeah, I would, and I appreciate the question, Jessamine, and it is hard when you're in the middle of the response to pick your head up and look towards the future, but we have to. And a silver lining of this dreadful, terrible pandemic, and we would have never wanted it, but it did put public health in a very visible place for the community. And there are things that we did in this response that have always been core to our work, things like disease surveillance, outbreak response, testing and contact tracing for a whole host of communicable diseases. Scott, Dr. Lindquist mentioned a few of them. The capacity to do that has, eroded over time before the pandemic due to loss of investment and funding. And, we have scaled it back, and it would absolutely be a lost opportunity if we didn't continue to serve Washingtonians beyond the pandemic and beyond COVID-19 to address some of those other critical communicable diseases like hepatitis, but others as well. And then there also have been innovations. So you heard Dr. Lindquist talk about genotyping. We have had to and have had mixed success, but largely great success in engagement with the public around the pandemic. And that is a huge opportunity for us going forward that we have to build on. And then I think most importantly, the pandemic, the broader situation around us in society has brought racism as a public health issue to the forefront. and called attention to equity in a way that we haven't seen before. And we see those gaps and disparities in all types of issues, not only even communicable disease, but also chronic disease, child development, and a whole host of issues that are important to the health and well-being of people and families and communities in Washington State. So continuing to build on the progress that we've made, both in terms of relationships, partnerships, and capacity, but carry it forward to other areas of health, just to build a better society post-pandemic.
Yeah, and let me just, Julie, last thing I would say to what Lacy and Scott just brought up is that Washingtonians would expect that of us. They would expect us not to build all this capacity and just leave it behind. They would expect us to build back better and really build a system that is truly transformational health. And you have a new Secretary of Health, and I guess I'll still say new for the time coming, because this last 6 months has really been quite a bit of a whirlwind tour on how you fight a pandemic when you begin a brand new position. But I will say that at the end of the day, that's what this is going to be about, is that my vision, our vision, DOH's vision, and state's vision is really to build back better and to do what we can to really help communities that have been impacted by this pandemic well beyond COVID-19. And as Lacy nicely said, it's really about really building on the know-how and the knowledge that we've gotten here, so we can really look at other issues and other challenges and address those head on as well.
Thank you. We have 3 reporters left in the queue. Our next one is Ariel from the Spokesman Review. Ariel?
Great, thank you. I have 2 questions this morning. First, do we have an update on the myocarditis investigations? And secondly, how many organizations have requested caravan vaccine clinics, and are the majority of them in Eastern Washington? Thank you.
Thanks, Ariel. Scott, I'll turn it to you on the myocarditis piece. I know the CDC team has been supporting us, and we've been working with King County and other local health departments. And then maybe Michelle, Lacy, if you guys can answer the caravan question.
Yeah, a quick update on the myocarditis and pericarditis. We have received about 90 inquiries for possible cases. The team has gone through the majority of these. We are getting data out of these chart reviews that are really mirroring what is seen around the country, which is there's a predominance in males that are younger. The association is not clear. CDC is being crystal clear with us that this is not a reason to pause the vaccine. The majority of these cases are mild, self-limited, may need a little bit of treatment, but are recovering. There have been no deaths. And we are probably going to wrap this chart review up by midweek next week, and we'll do a summary report of that. So it is not uncovered startling or concerning trends.
And on the hard numbers for the caravan, Ariel follow up with Julie afterwards, and we'll make sure we get you that information on how many requests we have and where in the state we are going.
Yeah, the good news is that we have received a really strong support from, strong interest, I should say, from our community-based organizations. And so just want to, again, thank everybody for that. And Michelle, I think you have an update, because
we've got a chat box going on. I asked to get the hard number update. So we've had over 25 organizations so far request caravan services. And remember, that is part of our effort to help make vaccine accessible to all in the places where people are going, to make it really easy for people to be vaccinated and continue to reduce those barriers. Those organizations are really across the state. So 25 organizations across Washington State so far have made a request for our caravans to come. And the information, if you want to request a caravan site, information is on our front page of our website about how any community-based organization could request a vaccination services at one of their events.
All right, thank you. Our next question comes from Nicole Jennings at Cairo Radio. Nicole?
Good morning. Thank you for taking my question. With all the people having trouble with my IR, and I actually am one of them, born and raised in Washington State, gotten every vaccine here since I was a baby, and yet I can't find myself on the site. Oh, so what are your plans for in the future having a more reliable online database that works for people? And I'm also wondering how this could affect us when international travel opens up, or looking at possibly the Canadian border opening soon. Are we going to have to rely on this website that may or may not show us our data? Or is there going to be a better way, like our little cards? And I will say that I did call the Vax hotline and they were very helpful and they did find me, but I just can't find myself on the site.
Yeah, thanks, Nicole. And I think this is, we've obviously learned and evolved since we started this process. And I will just make a longer term comment, and then I'll turn it over to Lacy and Michelle about my IR in specific. The longer term and global comment is that this is really about data systems and database systems and investment in technologies from a long-term standpoint. Again, that goes to the earlier question that Jessamine had asked about, where do we see investments for the future and where do we see this as transformational health? I think part of that is also investing in data systems and database systems. So I just want to say that in the long term, that is the direction we want to go. Not that there was anything wrong with the system that was in place. It's just that it's a little bit more clunky and it's not as easily navigable. And so that has meant that it's been challenging for some people. I do want to make it very clear: the vast majority of people have had no issue. So the vast majority of people have been okay. It's just been some people, especially with some discrepancies on the information that a provider may have entered in to the system, and the way to go back and try to match that after the fact, especially if you remember that a lot of people got vaccinated earlier on in the process and so many different modalities across the state. It's hard to know the data that's in there. Is that really the matching the data 4 or 5 months later when a person goes back to check their own information? So there are just some things that we've learned, and obviously we've made adjustments as I alluded to a little bit earlier. I would just say that we're going to continue to evolve. I mean, ultimately, this is about serving Washingtonians. We would not want to have a system in place that does not serve our communities, because that's not that it doesn't help anybody. Certainly, it's not our goal at DOH. So we're doing everything we can to make it. Remember, we said the easier process for experience as well. And this is another one of those, improving the experience on how people check their information. Lacy?
Thanks. So in terms of some of those other things that might precipitate a need for proof of vaccination, absolutely, your card is one thing you can have. You can take a photo of your card. That is also acceptable. Your healthcare provider may have an electronic health record if you have a patient-facing portal. And then, of course, we're working to make our system more user-friendly and accessible for both for COVID vaccine and for all of the other vaccinations that Washingtonians and their children may be getting. I do want to, note that, like many things in the pandemic, this was scaled very quickly. And like any data system, it is limited by the quality of data and the amount of data that go in. And one of the biggest gaps we're finding is for people who don't match, their phone number or email or both are missing. And that can be a lot of things. The person may have chosen not to provide it. The provider may have not entered it because they had thousands of people to enter from those mass vaccination clinics. And so, as we're doing quality improvement on a scale that is really unprecedented, like many things in the pandemic. But Dr. Shah is 100% right. We want to make this system better and all of our systems better as we go forward. So we'll keep working through it.
Thank you. Our final question comes from Jake at King 5. Jake?
Thanks very much for the time this morning. We've been kind of nibbling around the edges at this one all morning, but what specifically are we seeing in terms of the effects the lottery may have had on the vaccination rate? Have you noticed evidence, and what evidence is there to suggest that that's happening? And then a second part of my question, if I may, what, if anything, is being done to make the testing system a little more robust to start searching more for this Delta variant, which appears to be especially contagious? Thank you.
Yeah, we'll turn the Delta variant over to Scott. I think Lacy made the comment, and Lacy, you may want to add something to this, but made the comment earlier that it's likely too early to tell about the impact of the lottery and the incentives from just last week, late last week, to where we are with our numbers. We are watching it closely. We're looking at what we would potentially even look at as projections of where we could have been without incentives, and where we are going to be with incentives. And obviously, it's still going to be a projection, because no one knows, particularly where, what could have happened without them. But we do believe that these incentives are going to move some people, and that's the reason they've been used around the country, because some people are motivated by these things. And we hope people are motivated just to protect themselves and protect their loved ones and ultimately their communities. But we know not everybody is all the time absolutely in that direction. So Lacy, you may want to answer more on that, and then I'll turn it to Scott.
Yes, in terms of actual vaccine doses delivered, it's a little too early to tell. We have seen some early signs. So those early signs are increases in booking requests to the VaxHelp hotline. So there's an increase in people calling the hotline to book an appointment this week over last week so far. We have heard anecdotally of clinics filling up. So we have hope. And as Dr. Shah mentioned, we've seen in other states the lottery increase uptake. We'll hope that by the end of this week or this time next week, we'll have a little more to share in terms of actual people initiating vaccine.
Yeah, and to talk about the Delta variant, and so what was discussed here, slipping in, is this name change where the WHO is getting away from nomenclature like B117, which was the alpha strain, to more common nomenclature, Greek nomenclature like Delta strain. So the direct answer to your question is we are isolating all strains. It doesn't matter if it's strain that's called out. We're genotyping about, last month we did about 17% of all our positive specimens, which puts us in the top 3 states for doing genotyping. So we are indeed looking at every variant that comes through the state of Washington. The Delta variant in particular that we're talking about has not been a large percentage of our variants. It's really right now only about 4%. Our largest variant, of course, is the alpha variant, or the B117, or what was previously called the UK strain. The concern for that was that that was going to be this massive explosion of cases in Washington state. And that has not really been borne out on this last round of testing. The B117 has been very stable and is being decreasing a little bit as other strains are on the rise, notably the P1 variant. But the Delta variant is a small percentage. We are detecting it, but it has not taken on a big percentage of our variants of concern.
This concludes the question and answer segment of our briefing. Now we will go to Secretary Shah for closing remarks.
Can you hear me, Julie?
Yes, we can hear and see you.
Okay, perfect. So again, I just want to thank my fellow panelists, as always, Scott, Michelle, and Lacy, for being on this briefing. And we've been doing this for now months together, and we are just about to hit the 6-month mark, again, with vaccine experience in our state. And it's been very successful, but we have momentum that we need to continue to move forward so that we can continue to vaccinate as many Washingtonians as possible. I want to thank Brian Haight for joining us with LNI, and particularly his Director Joel Sachs has been just incredible partners for us at DOH. And I just want to say thank you, Brian, for joining us today and helping provide some additional insights into how establishments, the rules work for the establishments in our state. Ultimately, we've got a lot of work to do. We know that we've been successful thus far. We know that people across the state of Washington can get vaccinated in a way that they have not been able to get vaccinated prior, because the access and the opportunities are there. We're doing everything we can to continue to improve any new initiatives or new activities. Caravan is one example of that. The lottery is another example of that. And obviously working with our partners across the state, across our federal system, as well as our local partners, and making sure that we do everything we can to make sure that Washingtonians, remember, don't hesitate, vaccinate, that they do everything they can to get vaccinated for themselves, their loved ones, and ultimately their community. We want to also close by saying that if you are vaccinated, you're protected. If you're unvaccinated, you are unprotected. And we want to make sure that you get protected and that you can also win money and prizes in the process, and that hopefully will motivate some people to be able to get vaccinated if they have not to date done so. And finally, we want to also recognize that people should continue to respect the rules of the room, and they should really encourage those around them to get vaccinated and themselves to be able to respect what the rules are of the establishment or the jurisdiction that they're in. And so if that means including wearing masks, please wear masks. Please do not shame others as they decide they want to continue to wear masks, even if they're vaccinated for the time being. Please continue to be civil with each other. And with that, we're going to hit the 6-month mark Tuesday of next week, and we'll come back a day later to talk about it. So thank you so much. With that, Julie, I'll turn it back to you to close.
Thank you, Dr. Shah. This concludes today's media availability. We would like to thank our panelists for their time and TVW for hosting today's live stream and archives of past briefings. Thank you and have a great day.